name is Dr. Alex Eingorn. I'm a chiropractor, and I practice in Manhattan, New York, for the last 25, well, 28 years really, but 25 years in the same location. And I'm really glad to see you all because back about 12 years ago, I realized that I may have been a little bit crazy to get into Scenar therapy. It was one of those flukes, but it's nice to see other crazy people here. Thank you. So, couple of questions. How many of you are medical doctors? And can you maybe show of hands? And the other people are allied health providers, like alternative health practitioners. Yeah? Okay. And how many of you own at least one or more Scenars? Excellent. All right, so let me just boot this presentation up and we will move on. If I can find it. There we go. So I was invited to talk to you today, not so much about Scenar technology per se, but just to share my experience with Scenar in my private practice and my personal life for the last 12 years. So I want to start this presentation by quoting Dr. Albert Schweitzer, who was one of my favorite doctors. For those of you who are not familiar with his work, he won the Nobel Prize for studying indigenous medicine in 1952. And he said that every person carries within him an inner doctor. And we're at our best. Oh, should I translate to Russian as well? So let me just finish the quote and then we'll sort this out. So we're at our best when we get this inner doctor to get back to work. So I find that to be very inspiring. So getting back to your question, does anyone need translation into Russian or any other language? Да, кому по-русски нужно? Perhaps in that case, maybe we can group those people that need translation into Russian to like one area, and then somebody can do a simulcast. Otherwise, it'll take me twice as long because I'll have to repeat myself in Russian. All right? So, значит, давайте мы соберем русскую группу в одном, так сказать, и вы просто будете переводить им там, потому что иначе это займет просто вдвое больше времени.
Так, кому нужен перевод на русский язык?
Руки поднимите, кому нужен на русский перевод.
Кому перевод нужен на русский? Можно это самое? So let's get them all somewhere together, and then this way we can just move on with the presentation. Is that okay with everyone? Okay, cool. All right. So I'm going to move on because we kind of have some ground to cover. So my presentation is called Bridging the Gap Between Technology and Natural Healing. So as a chiropractor, I practice what's called natural healing. My primary mode of treatment of patients is spinal manipulative therapy. But sometimes that is just not enough. And as much as the doctrine of chiropractic says just adjust the spine and then everything else will take care of itself, it's kind of like in the Bhagavad Gita it says just practice yoga and everything else will take care of itself. That is just not true. Sometimes you have to resort to other methods because the body is stuck in some kind of lock loop mechanism and it just won't recover no matter what you do. So this is when we have to look at adjunct modalities. And I've used the Scenar probably, many times a day, every day on many of my patients. Not all, but a good number of them. So there you go. The biggest challenge we have in modern medicine and healing is pain. And and as much as most people will say, oh, no pain, no gain, I'm of a different school of thought. I say no pain, no pain. And that just works better. But it's a big problem in America, especially, and I understand worldwide as well, because the use of over-the-counter and prescription pain medication is skyrocketing, and we see a lot of tragedy. We see addiction, we see death, I had a case a few months ago. This guy came to see me, a medical doctor himself. By the time he came to see me, he was on 8 Percocets a day, and they weren't working. And he was really suicidal. Okay, we fixed him. It took a little while, took about 2 months, but now he's back to work, back to normal, no more drugs. But it's a big problem, and this is the way we deal with, most doctors deal with managing pain today. Right? There's also side effects, and there you go. This is my general statement on how it's addressed in our society. So we're here to try and come together and hopefully change that trend. There are other challenges. I mean, just imagine the industry that's looking at us and saying, well, what if they reduce the use of pain medication by, say, let's be modest, 5% a year. That's a big threat to a lot of industries. So we have a battle ahead of us, and as long as we stay united, I think we have a very good chance of making some positive impact. So another one of my idols is Sir William Osler, who said in his time, the person taking medicine has to recover twice. Once from the medicine, once from the disease, and once from the medicine, of course. Sometimes they don't recover from the medicine, even as much as they may recover from the disease. So these are challenges today in my chiropractic practice. So our goal is to get them off the drugs into a healthier state of mind. And I find that very often Scenar therapy, in addition to what we do, is irreplaceable. Without that, they just won't recover. By the way, if you have any questions as we go along, please feel free to ask. I'll address them as I can. And if it's too complicated, we can address them after. Yes?
You mentioned that along with your chiropractor, how good is the Scenar therapy without chiropractor, like if somebody is not doing manipulation?
I have a good cohort of patients that come to see me just for Scenar. So,
May I ask you something?
sure.
Before you start answering the question, repeat the question.
The question was, how good is Scenar therapy without chiropractic work? And my answer was, it's very, very effective, and I have a cohort of patients that come to see me just for Scenar. We don't adjust them. There's no need for that. Sometimes the problems are not chiropractic in nature. I'll show you in a little while. Okay, so I'm going to present some interesting cases for you today. Okay, Scenar, yes, I'm sorry.
Will your slides be on this CD?
I don't know. That is a good question for Tamara. Probably will. Yes? I did send my PowerPoint to her prior to this, so they should be. Anyway, if anybody wants my PowerPoint, just approach me. We can make sure you have it. Yeah? Okay? So this is my first Scenar. It's a 97.4. Does anyone have one of these? No? Okay, well, they'll probably go, they're becoming antiques, but let me tell you something. It is an amazing, amazing machine. You know, I still have one. It's a tank. I've dropped it. You know, I've left the battery in it for months.
You can't break them.
No, you can't. And they work. They really, really work. So when I travel, I always bring one with me. So I have one upstairs in my hotel room.
You can't find these anywhere.
No, you can't anymore, unfortunately. No, I'm never giving up mine. So this was my first machine. You know, very good. And I will tell you a story as to how I came about owning one. As everything in life happens for a reason, but it also happens as a fluke. Sometimes you think, oh, this is a coincidence. There's nothing like that. So when I first got this Scenar into my hands, I had no idea that, 12 years later I would be talking to a group of peers and actually presenting. So I'm very pleased. So this is the Scenar I use today in my clinic. So as you see, the design has changed. I think they probably tweaked some of the programs. Actually, I know they did, because this machine has probably 5 times the capacity and the different programs, the different protocols that you could use. Honestly, if I just told you, I probably use about, if 20% of the Scenar capacity in my 12 years, it's probably an over-exaggeration, and it'll take me a lifetime to learn. how to use all the features. So there we go. We also use attachments. It comes with all kinds of attachments. I want to show you some of these if you're familiar with them. Let's see. That one is very nice, the one with the probe. You can use it for acupuncture points. You can use it for all kinds of really nifty things. I'll present a case a little bit later, that one right here. Then the mushrooms, if you will. That's what they're called. They work very well for all kinds of different things. Those I generally use with my scoliotic patients when we need to cover large areas of the body. And then, of course, the attachment with a little bit of probes. Great for scalp treatments, all kinds of migraine syndromes, that type of stuff. And just an external electrode, which most of the time is used for self-treatment, because this way you can actually look at the screen and use the electrode. So there are a few others. I have one that's not in this picture. It's a double electrode for bilateral spinal stimulation. Very cool. So that's the technology. So now, just getting back to what I do, spinal manipulation, I call it tricky business. You really need to understand anatomy. You really need to understand neurology. And it's really not easy. I consider it something like doing neurosurgery without the knife, because you're dealing with very tiny areas, millimeters. One wrong move, and the person can really have some adverse effects. So and the nerves really are the strings of the brain. This is how the brain controls the body, right? So in a way, working with the spine is like tuning a piano. You really need to tune all the keys, because if C sharp is out of tune, you really can't play a concert, no matter how good you are, right? But sometimes, even if your keys are all okay, some of the strings may not be in good order. So this is where Scenar comes in. It's kind of dejunking information, retraining the brain to convey proper information and communication from the brain to the body, because sometimes patients come up with residual pain syndromes, and it's sometimes the pain stays there, the problem is gone, but the brain just keeps saying, let's generate that pain signal, and that's when Scenars come in very, very effectively. So let's move on. We actually got a lot of stuff to cover here. Okay, Scenar effects are said to be analgesic. We all agree, yes, on that. They're said to be parabiotic. I always wonder what that meant, but I found that a reference somewhere. So it means that it actually makes life better for the cell. It's anti-edematous. It's great for edema, as you'll see in a moment. Anti-inflammatory, of course. It's all good. I mean, it really has all wonderful, wonderful effects on the system. The trick to choosing the right protocol, in my mind and in my opinion, is really understanding what's going on with the patient, not only on a global level, but also on a cellular level. And in Chinese medicine, for example, they say, okay, too much heat in the liver. So cellularly, there may be too much heat or inflammation that could be not enough, maybe cold. So sometimes you need to increase circulation or decrease circulation, or stimulate the nerve or subdue a nerve. So this is when you start thinking about which protocol, bless you, which protocol am I going to be using, okay? So moving on. What is the appeal for us chiropractors to use Scenar as an adjunct? One of the appeals is rapid spot treatment. Sometimes it takes as little as 30 seconds to get an effect. You put somebody on DX1, bring him to 0, it's 30 seconds, and you say, well, how does it feel? And the patient says, wow, I feel better. It's almost like ophthalmology when you sit there and the doctor puts lenses in front of you and they say better or worse, and you say, oh, it's worse. If they pick another better or worse, oh, better, right? So really that's one of the ways to use Scenar. It's a very intuitive instrument, and as much as I found that there are some set protocols that are already established for different conditions, it really is a gray area. You know, you really have to play with it. You really have to try and sometimes figure out for yourself, or let the Scenar decide, which it does very well for you sometimes. So it does complement other clinical treatments, and in a way, for example, a lot of times chiropractors will use just traditional electric stim, but either before, after an adjustment, or ultrasound. These things take time. If they take a minimum of 15 minutes, sometimes 30, where Scenar is, in my opinion, a lot more rapid. Although I've had cases where, you know, you'd be there for an hour working with a patient. You know, it really depends on what you find, what presentation you find, and what you decide is your correct protocol is going to be. So we're also, it has audible prompts. Audible prompts are really more useful for things like self-treatment. Because if you can look at the screen and you're controlling the Scenar, you know, it's easy. But say you hurt yourself and you have neck pain in the back, how do you know, right? So this is where audible prompts come in. So you have to listen to the Scenar, and when you hear the correct number of beeps or the correct kind of beep, you know that you're actually doing yourself, you know, the correct treatment. There's measurable reliability of therapeutic effect. And I've seen this a lot, where a patient will come in, they have very limited range of movement, for example, and you actually do the Scenar protocol or some type of therapy, Scenar therapy with them, and then immediately after, you can actually measure an improvement, an increase in range of motion, decrease on the pain scale, although pain scale is a bit of a subjective phenomenon. But when you can measure range of movement, that's something real. Or for example, strength, the grip strength, that kind of stuff. And we see that. Okay? There we go. So let's talk about, well, applications, chiropractic. My advice to doctors that just start with Scenar, don't be afraid to get your hands dirty. You know, just get in there, do it, work it, you know, try different things. But keep it as simple as possible for yourself. So try the simplest thing first. If it doesn't work, you know, think about, well, what am I doing wrong? Go to the manuals, talk to your peers, and you will come up with a successful outcome. You know, I haven't had a case where Scenar therapy has not been effective. I can tell you that. Okay, so what I do, I run a center in Manhattan. It's about 5,000 square feet. And we do all kinds of neat stuff there. We do primarily chiropractic. We do spinal decompressions, which is the DRX 9000, for all kinds of lumbar disc herniations, facet problems, stenosis, that kind of stuff. We do Scenar, a lot of it, of course. We do thermography, which is a really emerging field, which I hope will replace mammography one day, because there's been, if you follow the British Journal of Medicine recently, published a huge study, 25 years, talking about how ineffective mammograms are, and there's no correlation between survival and having mammograms. In fact, women that did have them actually have a higher risk for breast cancer. But that's not where we're here today, so we're going to stop the discussion on that right now. Okay, there's acupuncture, and I actually work with an acupuncturist who uses Scenar to treat the acupuncture points as opposed to just using traditional needles. So that's also another effective application. We do all kinds of exercise, yoga, martial arts, meditation, nutrition, halotherapy, which is slowly coming to the U.S., which is dry salt therapy, which is breathing in dry salt, very good for the lungs. Again, that's not why we're here, but if you're interested in learning more, just contact me. Okay? All right, so that's the DRX, what it looks like. It's a good machine. It's more of a modern version of the medieval rack. It stretches you. We do get good confessions every now and then, but it's yeah. So that's not where. So these are some of the studies I'm going to present to you today. But my personal journey with Scenar began about 12 years ago when I came to my office. I have a gym, so usually I like to do a little workout before I start my day. That particular morning, I was in a rush. I didn't warm up and started doing pull-ups, and I tore my rhomboid. Hurt like hell, and I felt it go. I felt it tear. I was really mad at myself. It swelled up. It hurt. So as I'm sitting there with ice on my scapula and expecting, 6 to 8 weeks of recovery in hell, I get a call from one of my friends who's a physician, and he says, "Yeah, I got this guy in my office. He's got this interesting device. I don't know what to make of it. Why don't you see him?" So I say, okay. So in about an hour, this gentleman comes in. His name was Franz. He's from Austria. I don't know if any of you know him. You know Franz? Great guy, right? Absolutely. I just saw him. He came to New York a couple of months ago, so it was nice to reconnect. And he showed me this device, which I showed you earlier, that little tank. And we're talking, and I didn't tell him anything. He was explaining to me about the waves and the electromagnetic fields and everything like that. And then he says, "Well, can I demonstrate it for you?" He goes, "Do you have any pain anywhere?" I said, "Well, as a matter of fact, I got a little stiffness in my scapula." So we go into the treatment room. I sit on one of my treatment tables. He's behind me. He turns on the Scenar. I hear the tee, and then he starts doing something. He holds it for a while, and I'm thinking about it. Then he does a little bit of painting, which now I know is called painting. Right? And then it took him about, less than 10 minutes or so. And then he looks at me and goes, "How do you feel?" And I'm feeling this, and I'm saying, "Well, maybe it's a little better." In the back of my mind, I'm saying, "Well, maybe it's the placebo effect, which does have, placebo effect is a strong effect. It's about 50 to 55%. We all know that. So, and then we sit down, and then I go, "How much?" Really? All right, let me think about it. So he leaves, and, I go about my day. And then I wake up the next morning, and the most amazing thing happened. I wake up, and it's like nothing ever happened. It was truly, truly remarkable. I found it hard to believe. So I go to the office, I pick up the phone, I say, "Franz, you got to come back. I want this device." So ever since, I've been using the Scenar. So subsequent to that, he gave me a bit of a training. It was about 2 hours. Then he had to go back to Austria. And then a couple of months later, he calls me up, says, "Dr. Rivenko is going to be lecturing in Austria." Back then it was Rivenko was teaching courses. So I flew to Vienna and took a course with him, which really was a pleasure because he was lecturing in Russian. So while he was lecturing and while the translator was translating, I had time to make notes, which I found very useful. So then let's talk about some cases, okay? I'll try to keep it enough of that. So this case, interesting case. It was chronic low back pain of unknown etiology. This patient comes in. His name is Daniel. He came in with all kinds of x-rays, MRIs, blood tests, everything. It was inconclusive. He was pretty much living on Advil for about a year. And he had these serious spasms. No one could figure out what was going on. Of course, being a chiropractor, I said, all right, let's try some chiropractic. About 2 weeks into just chiropractic work, because I was still kind of reluctant to use Scenar on everybody. I wasn't sure of myself, I guess, or, So nothing happened. He was continuing to have the spasm. He still had to take medication. I said, well, you know what, there's this thing called Scenar. Let's try something. So within a week, and his protocol was basically 3 lines, 6 points. Back then, it's pretty much all I knew. So we started working with him. Within about a week, he reported improvement. We were seeing him about 3 times a week for about a month. And then I'll never forget the horrified look on his face when I said, you seem to be better. Let's reduce your treatment frequency to twice weekly. He was horrified. Okay? To make a long story short, at this point, I see him about twice a year. He's fine, he's exercising, but it actually was Scenar. And at some point, we just stopped doing any manipulation with him and just continued to Scenar. So that was a very good case. Any questions? Okay, moving to the next case. This was a very interesting case. This woman, about this short, an expert in Aikido. She could throw a lot of people around. She had surgery. She had a schwannoma removed from her brain. And as a result of that, when they had to put an IV in her, they damaged a nerve and a tendon, and she developed thicker veins and a neuroma, which rendered her pretty much incapable of work. She had to give up her work. She had to give up teaching swords, which was probably more heartbreaking for her than giving up work. And at some point, she was referred to me by Dr. Brown, who's a psychiatrist, but he's an avid Scenar practitioner. He uses Scenar in his practice, so there's application in psychiatry as well, apparently. So, but he's not in New York, but he was our psychiatrist for a certain time. She came to see me, said, I hear you have this thing called Scenar. So this is one of the cases where it was totally non-chiropractic, and I said to her, well, there is no set protocol for this. Any treatment we do would be purely experimental. And you have to make this disclosure to your patients, because Scenar is only approved in the US for pain management and biofeedback. I don't do biofeedback, but you have to tell your patients, if it's pain, yeah, but I don't know if it's going to resolve your other issues. Amazingly enough, her thicker veins recovered. Post-MRIs did not show any thicker veins, and her neuroma disappeared. It took about 2 months, and she was coming to see me about 3 times a week. Now, mind you, generally what we do, this protocol was just very local, but most patients initially are going to get, the bee sting just to introduce the Scenar signal to them. That's across the board. Then everybody is going to get some energetic cleaning. Everybody is going to get 3 lines, 6 points, and then we decide on other treatment that's more appropriate. But first, you treat the patient globally. Never treat just the symptom. Treat the patient. That's really the philosophy that we try to follow. So next case, Andrew. This was a very cool case. Actually, a friend of mine is also they trained together. Big guy, also in Aikido. Chiropractic patient from a number of years. One day he came in and said, after I was treating him, I said, so anything else? He goes, I got this hamstring tendon pain. It just hurts my butt. It's been going on for a long time. I said, why didn't you mention it? And he said, well, I didn't know if it was your thing because it's not spine. I said, let me take a look at it. And it was a case of tendinosis, which can actually be very, very troublesome sometimes, because tendinosis doesn't tend to recover very well because it's a flailing of the tendons. It's also a vascular issue. We treated him with this protocol, if anybody is familiar with that, one time, just once. And he came back a few days later saying, you're a genius. I'm back to normal. I can stretch. Great. So now every patient's going to, is going to respond differently, of course. But our job is to generally try and elicit, the healing. I was having a conversation with a friend of mine some time ago. He's a really cool guy. He's from India. He teaches yoga, Ayurveda, and he's also a Sanskrit scholar. So sometimes we have discourse about, healing, patients. And he put it in a very eloquent way. He said, our job is not to force the healing onto a patient, but to try and awaken the healing from within them. So that's really the principle of what we do. Yeah. Okay. Yes.
When do you decide to use Scenar? So if you have many patients, what are the reasons, or
Okay.
I would use Scenar for this patient?
Excellent
not
question.
for that,
Excellent question. As I said, primarily I'm a chiropractor. Oh, when do I decide to use Scenar? Do I use it for this patient and not for that one? Primarily I'm a chiropractor, so that's always first, okay? If it's anything spinal, if it's anything extra spinal, that's a flag for me that maybe we should try Scenar therapy, okay? Or when my traditional methods fail. And we give them a reasonable amount of time, at least 2 weeks of conservative management. And if they don't respond, then we'll say, okay, maybe we're missing something. Maybe the nervous system needs a little extra boost. because it's really the brain and the nervous system that heal things. It's not us. You know, I had a professor in grad school, Dr. Di Giacomo, really good guy, you know, a lot of clinical pearls. But I remember the first day in grad school, there's about 120 of us. Out comes this very, you know, distinguished-looking gentleman who's been a chiropractor for years and years. And he looks at us over, and this first lecture, and he says, all of you think you're going to graduate and become great healers. And then he gave us some statistics. He said, only 60% of you will graduate. And he said, all of you who are married, 50% of you are going to not be married by the time they graduate, which was all really true statistics. And then he said, and you think you're going to go out there and cure the sick. I'm standing like this. And he said, let me tell you something. He goes, there's only one thing that you can cure. And we're like, what? And he goes, that's a ham for Christmas. Nature cures the rest. So, true story. So I'm trying to convey this to you because, you know, it's really the patient that does all the work. It's their inner doctor. So our job is to use the Scenar to really kind of push this inner doctor. Come on, let's do your job already, you know. Jeffrey, an interesting guy, came in with tennis elbow, classic case. And I said to him, did you try out the different things, you know, anti-inflammatories, whatever, you know, the strap, the tennis elbow strap? He says, I did. And I said, so well, what prompted this visit? And he says, well, this morning when I reached out for my coffee, my milk carton to put in my coffee, I dropped the carton because it hurt too much. You know, says, can you do something for me? So this was a pure Scenar therapy case. We used this protocol, very simple. And he recovered fully within 3 weeks, which is really remarkable for a tennis elbow condition because they can be very, very persistent. I've seen patients with, I've seen patients suffer for longer than 3 months, you know, longer than 3 months, sometimes 8 months to a year, okay? So, and with conservative treatment. So Scenar is great for something like this. Okay. John, this was a very cool case. This guy was an ex-Marine, very interesting guy. He worked on the SpaceX program for a while, sleeps 4 hours a day, has a big brain. Came to see me and for some spinal pain, some headaches. And when we treated him, he said, well, doc, you know, I got this Achilles tendonitis. I can't run anymore. I've been going to physical therapy for 6 months. I still can't run. Anything you can think of. So this was in the early days of my Scenar. It was probably the first 6 months that I had it in my hands. I was really excited, and I said, there's this thing called Scenar. Let me treat you. So I treated him once. He came back 2 days later saying, you're a genius. Can I buy one of those? Subsequently, I gave him France's number. He bought himself a Scenar. Then he got his father a Scenar. So, and he fully recovered. I love cases like this, you know. It's a very good case. Very conservative and simple protocol. Yes? Excuse me?
In a normal practice,
Yes?
it's important to be in contact with the person while treating them with using a scanner. We don't touch them directly because it's been conveyed to us. You could actually absorb some of their energy.
Well, you know, that is...
How often as a chiropractor do you need treatment yourself because of this, close contact?
Oh, I see. Okay. You know, I touch patients all day long, and I absorb their energy. But, you know, I've done many years of meditation and yoga and that kind of stuff, so I clean it. I really don't absorb the energy anymore. It just goes right through me and out the window. You know.
You do yoga every day?
Yes, I do. So, and meditate. So it helps. Oh. A Scenar treatment? I only treat myself if I get injured. That's it. If there are no issues, then I don't treat myself. You know, it's not something you do for fun, although I wonder if some people do. Okay, so this was an interesting case. I'm not going to talk too much about it. This guy came in from South America. His name is George, and he had a shoulder surgery, and he's sitting in my office in one of the treatment rooms. And I say, well, what shall we do with your shoulder? And he looks at me and says, that's not what I'm here for. And I said, well, what are you here for? He goes, I have Parkinsonism. And he's a young guy. He's in his early 50s. And I said, well, I don't treat Parkinsonism. And he says, no, I have a Scenar. I've been to Russia. I've been to Dr. Ivenko. And he came up with this whole protocol, all written up. And he said, can you just please do this? So I did for a few sessions while he was in New York. And that actually helped. He went to Italy, came back, said, I walked all over the place. I felt great. Thank you. And then he went back to South America where he's from. So interesting case. So as you see, it's many different applications that you could think of. All right, this was another very interesting case. Friday night. And you always hope that you don't have an emergency walking into your office on a Friday night in the city. Why? Because none of the hospitals, all the doctors are gone. It's very hard to get them in, and then you have to stay extra hours, and and it's hard to find management. I could tell you a few stories about Friday night emergencies. This was one of them. The guy comes in, acute gout. His toe is swollen. He can't walk. And I look at him and I say, so did you have lots of lobster and beer last night? He goes, how'd you know? So that gave me a clue that it was actually gout. And so I said, look, it's going to be tough to get you anyone right now. You're going to probably need colchicine. Icing these things doesn't really work. Heating these things doesn't really work. Nothing really works. I said, all right, let's Scenar. We did. And he actually, the swelling went down, the redness went down. He walked out of my office without pain after 5 minutes of just very, very basic Scenar therapy. And I said to him, you really should follow up with your primary care, Monday, as soon as possible. Get some blood tests. You're probably going to need some medication. Yeah, thank you. Disappeared. 3 months later, comes to my office, with a little bit of neck pain. We treated him, and I said, look at my notes. Oh, by the way, did you ever follow up on that? He goes, no. He goes, I was fine after that. Go figure, right? So these are all true cases. So what I'm saying is, it's very exciting to see the family of, yeah?
Excuse me, what means
DX1, VAR? Oh, diagnostic 1 setting in the Scenar? Diagnostic 1, yeah. Okay, so yeah, it's very exciting to see a family of Scenar practitioners grow. It really is nice. So, this a couple really cool cases, and then we'll probably call it a day. This was a medical doctor who came to see me, a psychiatrist. She had a facelift, and right, and 6 weeks later, she's still having swelling, numbness in the teeth. She has paresis of the left eyebrow. She came, like classic case, and her surgeon said, "Well, I don't know what to do with you." So this was a case of, this is one case, like you said, she came specifically for Scenar therapy. She was a friend of Dr. Brown's, who was also a psychiatrist, and he said, well, you gotta go see him. So this was the protocol, very basic, bee sting, 6 points, cranial, DX1 to 0. She's still in treatment. This has now been probably about 3 weeks, and she's about 80% better. She's draining, her features are becoming more normal, she has control of her eyebrow, and the teeth are no longer numb. Okay? So, yeah, let's move on. Plantar Fasciitis, another guy, he's a sommelier, works on his feet all day long in this very fancy restaurant. Calls me up one day, says, Doc, I can't walk. I'm in pain. So very simple protocol. Took about 3 weeks, bilateral plantar fasciitis, so we worked on both feet, and he recovered. Wrote us a really nice review online. So, and the next case will be Cervical brain. This was a very tough case. This was a guy with radiating pain down his right arm, neck pain. Nothing really remarkable on his MRIs, but we see that a lot. You know, sometimes I look at a set of MRIs and it's like, I don't see anything, and the patient's disabled. And sometimes you look at a set of MRIs and you're like, how is this person walking? And they're like, well, I'm okay, just a little stiffness, you know, here and there. So, as I said, never treat the films, treat the patient. This was a very interesting case. I tried everything, you know, Scenar, chiropractic, traditional physiotherapy. Nothing worked until I called Dr. Evenko and I said, can you help me out? He's the only one I knew back then that actually did this. And he said, have you tried opposite side treatment? And I said, no. He said, try doing the same thing you're doing, just on the good side. I did, and that was magic result. So the brain works in mysterious ways, you know. Yeah.
How do you see the role of Skinner in the subluxation theory? Because this subluxation of the chiropractic. So.
Well, I find that Skinner actually helps them, you know, not have subluxations anymore. So, you know, we remove subluxation, use Skinner, and the subluxation, you know, doesn't come back. In a way, it's not really that great for my business, but you know, I still use it. Okay, so that was a very interesting case of, you know, so you have to really sometimes think about what is going on with the patient, and sometimes really think outside the box. Okay, that's what I'm trying to share with you here. Very interesting case. This was a case of TMJ and unilateral lingual nerve paresis. This patient had a dental procedure, and subsequent to that, she developed severe pain in the temporomandibular joint, which was not, most of the problem was that she lost control in half of her tongue, the right side of her tongue, and loss of taste, and that was very disconcerting. And, you know, about 2 months after the surgery, you know, her dentist says, well, I don't know, you know, and she's like, maybe he damaged my nerve, which he did. And she came to see me specifically for Scenar. Very, very, very interesting case. This is where we use that little intraoral probe, and we work directly on her tongue. We work directly on her inner muscles, on the pterygoid, on the TMJ from the inside. We did some chiropractic work because she kept getting a subluxation at C1, C2, and she actually recovered, but it took us about 4 months for her to regain full control and full sense of taste. So that was a very good case. Let's see, what else we got for you? Paul, this is a pretty straightforward case, a completely torn supraspinatus. Patient is in the 60s, decided not to have surgery. He knew about Scenar, came in, we just worked on the Scenar, very basic galena paint at that frequency. And he regained full mobility, he's out of pain. You know, I don't think he'll be able to do some things like play tennis on a competitive level, but it's really a quality of life issue for a patient like that. He's asymptomatic, so, you know, because all his doctors said, oh, we should have surgery, so no surgery. Scoliosis, it's a girl that I started seeing when she was 13. She's now 17. Her curve is about 20% reduced. This is a complicated case of chiropractic, and this is when we use those mushroom electrodes. There are some protocols that we followed for that to just rebalance the different, you know, points of the spine. Interesting case. We'll see how it goes. Her parents are happy, and she's fully functional. Her chest excursion's normal. She's not in pain, so we're just following it and, you know, continuing treating her. And this is yes.
Doing chiropractic treatment along with this?
Both, yeah, both. Mm-hmm. Oh, this was a good case. This is early on, acute low back pain, lumbar disc herniation. This was a case where I felt was going to surgery, and because the patient was in excruciating pain, he had weakness in the leg. I had the surgeon waiting in the ER, but he had to go to get an MRI before he went to the ER. So the radiologist calls me and says, this guy has got a huge disc, you know, it looks extruded. You know, so I'm like, great, give him the film, send him to Mount Sinai. The surgeon's waiting in the ER, and then the radiologist says, the patient wants to talk to you. So I get on the phone, and the patient says, Doc, you know, something happened during the MRI. I felt something click. I feel a little better. Can we hold off on the surgery? I said, well, all right, how's your foot? Can you move it? He goes, yeah. So I said, all right, let's just go conservative. You know, then he came back the same day, and we started on the DRX treatment, on the lumbar decompression and Scenar therapy, and I'm going to show you some interesting MRIs. This is a before and after. This is the before, of course, you can appreciate right there. You have a really large disc herniation, nasty. Okay. Can you see that over there on that side? And then after the DRX and Scenar, 3 months post-MRI, I sent him to the same radiologist. He calls me and says, isn't that the guy you sent me with that huge disc? And I say, yeah. He goes, where's the extrusion? I said, I don't know. It's gone. He goes, well, I find it hard to believe, but you know, stranger things have happened. So that's another interesting case study. So I think we're pretty much done. I think we're in overtime. Cool facts. I was always do some reading. There's so much stuff about microcurrents, and I found this at Rutgers University about why microcurrents work or how they work, and it's called jump proton conduction. Apparently water has memory, and if you've ever followed any of the work by Dr. Emoto, Masaru Emoto, The Hidden Messages in Water, wonderful stuff. So we're finding out things that we never suspected possible, you know. But this is how it works. If you put a microcurrent, then you put it through the water that has a memory of not being correct. I don't know really how it works, but apparently so. But then it actually causes the collagen to, yeah. That's the universal, yeah. Exactly. And then it causes the collagen to actually bind together in a normal way. Just a cool fact. All right, so just to wrap up, just reimbursement for Scenar therapy. For those of you who can take insurance, there's a few codes that you can use. You know, traditionally, these are 97032, G0283, G0295. These are all physical therapy codes. Reimbursement varies from state to state, from insurance company to insurance company. You know, we bill out probably $100 for a treatment. Anything more than 20 minutes, we bill $200. We have a good reimbursement rate. Biofeedback, I don't really use that code as a chiropractor, but you can. Yes?
So you get reimbursed even if you see a patient, like let's say 3 or 4 times a week
Yeah,
for each visit?
of course. If they have coverage, yeah, they reimburse us. It depends on their policy. I mean, if there's a coverage in the policy, but these are for insurance reimbursement. And you know, neuromuscular reeducation is another code. Okay, so you could use those depending on where you are and what type of insurance networks you're in. But that I think that's useful information. So, in summary, Scenar restores the 3G effect: good humor on many levels, good sleep, and good appetite. And if you have those, you're a healthy person. Okay. And well, other pain management, you might find this interesting. You could always ask your patient this. You know, you ever try just enjoying your pains? Some people do. There's no cure for that. And I just want to say to you, I think that you know, every chiropractor, every doctor should really have a Scenar as part of their doctor's bag. And that is my presentation for today.